All right, guys, this is Colin D again, North Texas Facial Plastic Surgery. And I'm here to talk about post-operative otoplasty care. So, otoplasty, oto means ear, plasty means to change, and a lot of times people come in with ears similarly shaped to this, and we're doing a surgery to help get those flatter to the head so they're just not quite as noticeable. There's a variety of ways we do that. I do what's called an incisionless otoplasty approach. We also do kind of a modified incisionless otoplasty approach with a very small incision. It really just depends on the case. More videos specifying kind of the differences between those are available, but right now I want to talk about after the procedure what to expect. So you're going to have some sort of handy dandy headband kind of covering the ears and holding them in place, and that's going to stay in place more or less for the first week. Now for 48 hours, I want you to keep it in place. So you're gonna look awesome just like me. If we do this in surgery, sometimes it's one that actually has a plastic cup and two little headbands. But for the first 48 hours, I want you to keep it covered, don't do anything with it. After the 48 hours, it's okay to take it off. And you can take it off to shower, but then you gotta put it back on. And so I want you to wear it more or less the first week unless you're showering until I see you back on day 6 or 7. Now this one that we send you home with has a little Velcro strap that's a little bit thicker. So you want to be careful that that doesn't put pressure in the same spot over and over again. It can give you a little sore spot. It can actually make some of the hair follicles go into shock, and the hair can fall out temporarily. It comes back, but it's a little best avoided, obviously. It also helps sometimes if you just do it off center. So instead of maybe the midline, if you do it not over the ear, but maybe over your temple or your sideburn area, that makes it a little bit more comfortable than putting it right in the middle where there tends to be a little bit more tension. So that's just a quick tip on what to do with the headband. After 48 hours, I don't care what kind of headband we use. You can use a medical grade one, you can use the one we sent you home with, but if you want to get one that's a sports team or My Little Pony or anything else, go for it. It's up to you. So after that, they're going to look a little red and swollen and be a little bit sore to the touch. So we do recommend that you sleep with a neck pillow. Not necessarily to protect the ears directly, but because it helps prevent you from rolling over and hitting your ears in the middle of the night. After a couple days, if you wanted to, you can even take it off and then put your ear in the pillow. That makes it a little bit more comfortable. If they are tender, that tenderness is pretty variable. A lot of patients say it wasn't that big a deal, but I have had other patients where it's pretty significant. After the first 24 hours, we'll let you alternate between Tylenol and ibuprofen, but obviously we've got pain medicine too if you need it. But I want you to wait on the ibuprofen for the first 24 hours just to minimize the risk of bleeding or bruising. After that first 48 hours, it's okay to take a shower. It's hard to know how to get how much to get back there, but I want to take a Q-tip, some of those mupirocin ointment. You're going to do a thin layer of that on the Q-tip, and you're just going to go back behind the ear, just run it back in that area. I flipped it over so I don't get ointment on myself, but obviously you're going to put the ointment part on there. Just run it from the top all the way down the back and back behind there, or you can use your pinky if it's clean to do the same thing. You're going to do that twice a day and put your headband back on after doing it twice a day. I'll see you back on day 6. Take the headband off at that point in the clinic, and we will let you walk around without it, but I still want you to wear it at night for a month. The antibiotic ointment, usually we can stop at that point, but obviously individual treatment depends on how you're healing, but usually that's the case. So hopefully that's helpful. If you got any questions, obviously post-operatively, you'll be in contact with us, and just call the office if there's any issues. All right, hope that helps.